Hello, everyone. Thanks for joining us today. My name is Dr. Obadan. I am the CEO of Younger Self MD. It's a medical practice aimed at treating and preventing the onset of chronic medical conditions like chronic kidney disease, hypertension, diabetes. And today we're going to be discussing the topic ways to prevent worsening of kidney disease. I'm here with Dr. Ng, who's a fellow nephrologist. Dr. Ng, could you introduce yourself, please?
Hi, I'm Dr. Jia Ng. I'm also a kidney doctor based in New York. My other business is to help patients or help clinicians publish papers, especially research papers on kidney injury and kidney disease.
That is amazing. That's awesome. Thank you for joining me here today. In the next 10 to 15 minutes, we're going to be talking about 5 ways that we can prevent the kidneys from getting worse. So people who already have established kidney disease, what are the 5 things that they can do to prevent their kidneys from getting worse? So I'll start with the first thing, medications. There are so many different kinds of medications that can affect the kidneys. They can make the kidney function worse. There are a lot of things that you need to consider when you're taking your medications. You need to make sure that the dose is appropriate. So many different medications can hurt the kidney. We're going to focus on just one today, which is the NSAIDs, the non-steroidal anti-inflammatory agents. For example, ibuprofen, Motrin, Aleve, Goody powder. There's so many out there. They are very good painkillers, but really make your kidney function worse. So you definitely need to avoid taking these medications, especially in high doses for long period of time. What's your experience with this, Dr. Ng?
Yeah, I agree because it's everywhere, it's very effective. So sometimes people don't realize that just because it's over the counter, they think it's safe. Okay. And second thing I want to add on is that just because you have normal kidney function doesn't mean that you get a pass.
Exactly.
If you take a lot of it for weeks and weeks, you may be damaging the kidney without even knowing it.
Exactly.
Right.
They have so many effects. They make your blood pressure go up. They have other side effects like GI bleeding, and
Mhm.
on the kidneys make the function get worse. So that's very important. Remember to not take the NSAIDs, non-steroidal anti-inflammatory agents for a long period of time, and discuss with your physician if you need to take them. The next tip is salt intake. Dr. Gia, do you want to talk about that?
Sure. Okay. Salt is another thing that is available everywhere and sometimes is hidden, and we forget that salt can cause a lot of problem. So how it causes problem to the kidney is through 2 ways. One is it brings up the blood pressure, and when you bring up the blood pressure, you are actually making the kidneys work a lot harder. And when you make the kidneys work harder, the kidneys will get worse quickly. So always watch the salt. And another thing it does is it also holds on to a lot of water. And
Yeah.
so people can get like swelling or trouble breathing when they take a lot more salt. And talking about salt, where do you find it? It's usually in our day-to-day food. There's so much salt in our food. Think about canned food, think about all your cold cuts, also think about bacon. And of course, all the takeout food. Takeout food has a lot of salt. Dr. Obaden, where do you always see salt hidden?
Oh, I see salt hidden. Well, a lot of my patients always tell me how much they like the spices. There are some
Mhm.
spices that have lots of salt hidden in them. And like you said, the canned foods and soy sauce is also very high in salt content. So it's very important that you limit the quantity that you use. You have to just put a little bit of it. Don't just pour the whole sachet, or you see some people they just they pour like 4 sachets, and this is a high consumption of salt intake, and it's going to damage your kidneys, as we're talking about. The next tip that we have for our audience today is the hydration status. So it's very important for you to prevent yourself from getting dehydrated. You want to consume enough water intake. Try to prevent yourself, especially for people who drink a lot of alcohol, they are the highest risk for getting dehydrated. Or if you have an acute illness, let's say you have, nausea, vomiting, and diarrhea, or if you do a lot of exercise and you're sweating a lot, these are all the different ways that you can definitely get dehydrated and have your kidney function get worse.
Right, right. And sometimes also during the season, think about the season,
Yeah.
winter time, you sweat a lot less, so you don't lose as much fluid. But during summertime, especially when you're out, some people love gardening and they are sweating a lot. And so
Yeah.
be sure to drink some fluid after you're done with your activities.
That is so important. I can't tell you how many patients come in with their kidney functions getting worse, and especially in the summer because they've forgotten to drink fluids and now they come in, especially when they are taking other medications that dry out the kidneys, like the fluid pill, because they have other medical conditions, so they come in during the summer, they're not drinking, and then their kidney function gets worse. So that's a very important tip to remember. And the next tip we want to talk about, Dr. Jia, is the contrast use.
Right, right. So contrast, or we also call it dye, we give that when we order CAT scan.
Right.
So sometimes doctor needs to give these dye in order to get the better picture of the body when they do the CAT scan.
Exactly.
For people with normal kidney function, usually it's okay, but it is if you already have bad kidney disease, that dye can actually damage the kidney even faster. Okay, so before you get the CAT scan with the dye, talk to your doctor. Is it safe for my kidney? Or sometimes it could, if you even ask a question, they say, maybe we don't need the dye, or we can avoid the contrast. Just a plain CAT scan could be enough.
That is so true. That's very important, especially when you have advanced kidney disease. The worse your kidney function is, the higher the risk for you to have problems with contrast. That's a great tip. So the last tip that we want to talk about is people who smoke cigarettes and use illicit drugs like heroin, cocaine. You are going to get your kidney function a lot worse than normal. So it is advisable that you quit, you stop taking those things. There are 1,001 ways that those illicit drugs affect the kidneys. Plus, economically, those things are expensive. So you're wasting money and you're also damaging your body in the process. Imagine if we were in a world where everybody was protecting their kidney function and nobody needed to suffer from the complications of advanced kidney disease, including dialysis. That would be amazing. We'd be living in a world that would be kidney disease free.
Right, that would be great. And I think what we want to put out there is there are ways you can do to take care of your kidneys. Okay, and even if it gets worse, sometimes if we can slow it down, that may be good enough for you to go through your life without going through kidney failure. So that's most important for us.
Well, thank you so much for coming and joining us today.
It's my pleasure.
And tell the audience how they can find you.
So they can find me on Twitter at, we can put the link in the show notes. It's JIANG, sorry, JIAHWEING. It's a mouthful. That's why you can look for me on Twitter, or I'm based in New York at the Northwell Health System.
Oh, that's great. And I'm going to put my information down in the show notes as well. My website is www.theyongerselfmd.com. And I'm also on Instagram at youngerself.md on Instagram, and subscribe. Remember to subscribe to my YouTube channel.
All right. Take care. Bye-bye.
Take care. Bye-bye.